Hello, how are you? Today I'm going to talk to you about the relationship between avocado consumption and blood sugar. Many people who want to better control their blood sugar are unsure whether avocado is a fruit they can eat, if they should avoid it, how much they can eat, and how to consume it the right way. This is a very important detail. So, I'm going to tell you all about it right now. Stay until the end because you will not want to miss it. If you love tips on nutrition, health, and fitness, you're going to love this. I post new videos every day and you're going to enjoy them. I also have a video talking about the best fruits for diabetics. Of course, I'm talking about diabetics, but anyone who wants to control their blood sugar, who has prediabetes, or who wants to lose weight, knows all of this is connected. Tell me if you usually eat avocado and how you like to have it, savory, sweet, or if you have a special recipe. I would love to see your comments. When we look at avocados, they often scare some people who are trying to control their diabetes or their blood sugar. Many years ago, when someone started a diet, they would stop eating avocados thinking they were too high in calories, that avocados make you gain weight. And if you wanted to lose weight, you had to stop eating them. Today we already know that is not true. Even though avocados are indeed high in calories, they are a fruit with healthy fats, rich in fiber, and with a very low amount of net carbohydrates. Net carbohydrates is a term I mention a lot. If you have never heard of it, we get the net carbs by subtracting the amount of fiber from the total carbohydrates. That number is the net carbohydrates, the carbs your body will actually absorb and use. The amount of net carbs in avocado is very small because avocados are rich in fiber, and fiber does not affect blood sugar. Avocado also has a very low glycemic index. In addition to having little net carbohydrate, the fiber content is high. The amount of healthy fat is high. So the absorption of this carbohydrate is slow and gradual, which helps prevent spikes in blood sugar or insulin levels. Even if you eat avocado on its own or add avocado to a banana smoothie, it will help control the glycemic index of the meal. The fibers in avocado help improve the glycemic index, slow down the absorption rate, keep blood glucose more stable, and contribute to other factors that help control blood sugar. They help increase satiety. You will notice that avocado makes you feel very full quickly, and that feeling lasts longer. It provides prolonged satiety because the fibers and fats take longer to digest. So you end up eating less of other calorie-dense foods. Because avocado contains fiber and healthy fats, it also helps intestinal transit. Many people living with diabetes complain about constipation or a sluggish bowel, and avocado can help with that. Avocado is a source of monounsaturated and polyunsaturated fats, and is rich in vitamin E, making it good for the heart and arteries. When we talk about fat and the heart, it may seem like they do not go together, as if you need to eliminate fat from your diet if you have heart issues. That is not true. You need to choose good sources of fat, because fats are important. They help transport fat-soluble vitamins, provide energy, and the right fats can help reduce inflammation. Avocado does this and helps protect the cardiovascular system. Avocado can also help with weight control. If you consume the right amount, it helps increase satiety, keeps you fuller for longer, helps control blood sugar fluctuations, and helps prevent insulin spikes. All of this supports weight control, which supports diabetes management. It becomes a cycle of benefits if you use the right amount. The right amount depends on each person, your needs, your physical activity, and the rest of your diet. On average, 1 or 2 tablespoons of avocado can be a good portion to add to a meal, a salad, or a smoothie. Maybe you need more or less. If you have questions, talk to a nutritionist. Avocado is also rich in potassium, a mineral linked to cardiovascular health. It can help control blood pressure by helping the body excrete excess sodium, which reduces swelling, water weight, and supports cardiovascular health. It is also rich in magnesium, a mineral that helps with insulin sensitivity and glucose metabolism. If you want a fruit that brings micronutrient benefits and supports blood sugar control, avocado is a strong option. Avocado is also rich in vitamin E, antioxidants, and carotenoids. People living with diabetes tend to have a higher production of free radicals because elevated blood sugar stresses the body. This increases free radical production, and consuming antioxidants is important to prevent complications. Avocado provides natural antioxidants that help with this. Avocado is not a miracle worker. It will not help if you add it once a day while having an unbalanced diet high in sugar, simple carbohydrates, high glycemic foods, saturated fats, trans fats, or if you are sedentary or smoke. Your lifestyle supports the benefits. There are precautions when consuming avocado. One is the amount. Another is what you add to it. In many countries, avocado is used in savory dishes like guacamole, avocado, mayonnaise, salads. In other countries, people eat avocado sweet. That is where the danger is, because avocado has little flavor, so some people add lime to keep it from browning, then add sugar, condensed milk, and it becomes unhealthy. Ideally, eat avocado in a savory or neutral way. It works well in savory dishes. If you want to make a smoothie, a green juice, or an ice cream, you can add a non-caloric sweetener like stevia, which gives sweetness without changing carbohydrate content or raising blood sugar. Tell me if you already knew about this relationship between avocado and blood sugar or diabetes, if you already eat it, or if you will start eating it. I would love to see your comment. Remember to like the video because that helps me. Share it with anyone who will enjoy it or needs it. See you next time.